Hi, I'm Dr. Burt Webb. Started here in 1980 and have been here ever since practicing OB/GYN. I have a number of interests in obstetrics as well as gynecology, of special interests where I do special procedures and have special techniques, but I enjoy taking care of women. Women should know that there are many different kinds of hysterectomies, and recently there have been some great advances in our ability to do hysterectomies through smaller incisions. There's some great procedures that I do that most doctors don't offer, and these would involve minimally invasive surgery, which means doing bigger procedures in a more simple fashion so that women can recover more quickly and maintain their normal lifestyle much more easily. Some women who are told they need a hysterectomy, they may not need that. One of the areas I specialize in is evaluating fibroids. And there are some fibroids that can be treated without surgery. And some women will have heavy periods. And these women don't necessarily need a hysterectomy. They can have a very simple 5 or 10 minute procedure in my office and their bleeding will be cured. One of the biggest misconceptions that women have about having a hysterectomy, for example, when their doctor tells them you need a hysterectomy, they don't realize that there are a number of different options, that they just don't have to go in and have an incision and have their uterus taken out. There's a number of different aspects they need to think about. For example, do you take the uterus out and leave the cervix in? Do you take the ovaries out? And there's a lot of new information that I think it's important for patients to have so that they can help make better decisions. And that's where the laparoscopic approach, which just a few doctors specialize in. It's an area that I've been doing for a long time. This laparoscopic approach is really wonderful because it allows me to make very small incisions, sometimes the size of a pencil. And with 3 incisions, sometimes 4, I can look through the camera, get a great picture of the whole surgical area, and then remove the uterus, tubes, ovaries, cervix, whatever the patient and I have discussed and agreed on, and do this through these tiny incisions. Patient has very little pain because the incisions are so much smaller than with a big regular way of doing a hysterectomy, and so they recover faster. Yes, they do have pain, but they tend to get over that pain much more quickly and get back to a normal lifestyle much more quickly. The newest advance is the robotic hysterectomy, which is a great tool and allows me to take more difficult surgeries and make them much more easy. So I saw a lady recently who had a very large uterus, and she was planning on having an incision, which would have been a big incision, but I was able to use the robot and through 4 very small incisions take the uterus out. She went home the day after surgery and has felt great since. Women are fortunate in this state that there are a lot of well-trained, great OB/GYNs. There are a few of us that have special training in laparoscopic approaches and some other procedures that are really taken to help women improve the quality of their life. Whether it's surgery or an ablation or lifting their bladder, the key thing is that women are so important in this society. I'm able to do these newer techniques so that women can get back taking care of their family, back into business, back exercising, and get back into their lifestyle that they want to be.